Welcome Paul Brugger to talk about patient safety and quality improvement in e-INR, enhancing patient safety and quality improvement. We would really value your interaction with this, so please, in your toolbar, you'll see a Q&A button. If you have any questions or comments, please use that. Just type in your question, and at the end, we will come to as many as possible. Please do feel free. Paul also has an exhibition page within the platform, so if you have any specific questions afterwards, if you go there, you'll be able to connect with Paul. Paul has worked in the IT sector for over 20 years and has extensive experience of working with many blue chip clients at every stage of product lifestyle. But today, Paul is going to present on a technology close to his heart, and as a long-term warfarin user, one which he's worked closely with medical centres and his local health board to enhance the experience and safety for anyone taking warfarin. So without further ado, I'll pass over to Paul. Thank you.
Hi everybody, thanks for your time today. Thanks Joe for that introduction. Yeah, just to reiterate, I'm discussing about our technology, which is called MedChart, and how e-INR service can enhance the patient safety and quality improvement. So the presentation will consist of my personal story, my technology, and how I feel it can help patients and improve quality. And finally, a live demo. For the demo, I'll provide a link in the comments. However, if you're watching this in a recorded version, you'll need to scan this QR code. So I'll leave this QR code on the screen whilst I tell you my story. Originally from the UK, I was the global delivery manager for a fintech solution provider. I had 2 technical teams and a QA team delivering our solution worldwide. In 2008, I moved from the UK to Ireland and decided to set up my own technology company. A couple of years later, in 2010, I had a PE. I was rushed into A&E and was in intensive care for 4 days. I was told countless times how lucky I had been. After being discharged, I joined the long queue every Friday to have my e-INR checked. The process took several hours and 2 trips to my local hospital. Typically, there were 30 or 40 people ahead of me in that queue. In 2012, I became a self-tester, which made things easier. No more visits to hospital and their waiting rooms. So back to the technology side, in 2010, we launched our technology. It is for the aviation sector, and we help automate two-way passenger engagement. The service is omni-channel and uses technology like artificial intelligence and machine learning. So effectively, our technology controls or manages the communication for airports. That's the passenger communication for airports. As you probably are aware, the aviation took a big hit during COVID, and in 2020, we repurposed our technology for the healthcare sector. We are working with healthcare providers in Ireland, helping them automate the patient flow into and out of the clinic. So patients can check themselves in, wait virtually, and proceed into the clinic once the clinician is ready for them. We also answer patients' questions in real time, and this is typically via WhatsApp and web chat. Last year, my self-testing process changed. I had to send my results to the clinic via SMS. SMS is old technology and made me wonder if our technology could add value. Speaking with Thrombosis Ireland and through their network, I quickly learned each clinic had different processes. Some SMS, some email, some by phone. All of them were very manual processes. So the question I'd like to throw out here is legacy technology still the best way of communicating to patients? Things like SMS, email, letter, phone. SMS is 30 years old later this year. Our technology, MedChart, is already proven in the healthcare setting. We are providing functionality around reminders, notifications, timed messages and patient flow into and out of the clinic. So patients receive reminders, they're able to check themselves in, they wait in their virtual waiting room, which could be a coffee shop or their car, and they're asked to proceed into the clinic. Another use case for our technology would be the home testers. Send them a reminder on the day of their test, and then automatically communicate to them and be an automated communication channel with the clinic. Our technology is already being used for patients' FAQs and wayfinding. According to Roche, the first 3 months of COVID saw a higher increase in home testers than the previous 3 years. Self-testers were typically more technically savvy and use various devices. When you are self-testing, how do you connect with your healthcare professional? MedChart, our technology, uses platforms that are pre-installed onto smartphones, so there is no download. These are all platforms, they are already in use every day. So things like WhatsApp, things like Facebook Messenger, things like Twitter. So the current process that I have to go through is, as a self-tester, I have to remember to send an SMS on the day of my test. So I send a message with my e-INR, and then 4 days later, I receive a letter with the healthcare questionnaires and my dosage from that point on. So there's a few areas I believe our technology can help. First of all, the patient has to remember to take the test. We can send an automatic reminder on the day of the test, meaning that if a patient does forget, the clinic doesn't have to follow up with a phone call. Patients can enter the wrong result. Our technology can qualify that result. So we can say, are you sure your e-INR is 2.1 today? Patients don't receive an acknowledgement. So I send an SMS, I get no acknowledgement. I'm assuming the clinic have received that result. Once the clinic do receive the results, they have to manually enter a third-party system with the e-INR rating. So there's human manual intervention, which is open to risk. And then there's the time delay. I have my health questions, dosage, and my next date for testing up to 4 days later. It's all sent by letter. So what I would like to go through now is a live demo of our technology. In the chat, you'll see a link you can click. Hopefully you can see that now on my screen. There's a link you can click. And what that will do is open up a WhatsApp conversation. So you will be initiating a conversation on WhatsApp. On screen, there is the QR code that I showed you earlier. So that you can scan that QR code, that will initiate the same conversation. But also at the same time, I would like to demo our service via web chat. So the function or the technology is the same across all the various different platforms we operate on. So what you see in WhatsApp, you will now see on my screen in web chat. So hopefully you can see on the screen now web chat on the bottom right of the screen. You can ignore the left-hand side. So this is a website. And this will now be the same as if you're now using WhatsApp, you'll see the same thing, but I'm going to initiate the conversation. So if you have clicked the link, you follow the instructions through, you'll send a message to our technology, which is effectively saying e-INR. So it's just going to initiate the conversation. In a live environment to a patient, the conversation will be initiated by us with the reminder, and they will click a button to do the same as this next step now. So we're now asking here for my first name. I can enter my first name. You'll see on the screen and on by WhatsApp, we have an image, so it's all branded by the hospital or the clinic. As a patient, I enter my first name. I then enter my second name. And then we can see a list of the healthcare questionnaires. So this is just a shortened version for this demonstration. Are any of the following true? On WhatsApp, you'll actually have a button which can make it. We can have a button on both web chat and WhatsApp. But in this demonstration, I've just had a little bit of variety, so you can see again from a configuration perspective, we can tailor it based on the platform. So in WhatsApp, if you're using a WhatsApp, click no, none are true. I will enter free text here saying no, and then it's asking me now for my e-INR results today. Now I can put in a low result and it will ask me to contact the clinic, or I can put in an in-range result, and that will congratulate me that I'm in range. And as I say there, the conversation flow is defined by the clinic. So those questions being asked, there might be a patient PIN to validate the person. We already have the telephone number via WhatsApp, but all those images, text and buttons are all user defined, so clinic defined. So what I'll do now, that's the end of the demonstration piece. I'll just flick back to the presentation. So if you didn't use WhatsApp, hopefully you saw it via web chat, but also what you will have seen on WhatsApp is something similar to this screen here now. So at the very top, you'll see MedChart test. This would be the clinic name. We would see the branding of the hospital or the clinic. We go through a similar process. As I said, that validation step in terms of the person might include a PIN or some other way of validating the person. We already have their number because we have the WhatsApp number, so we know that the person is the person on the telephone number. We then have button technology here, so the person can make it simple and just click a button to say none are true or at least one is true, and then we have e-INR reading. So this is communicating back to the clinician, and they can then manage that process going forward. So as simple as possible for the patient in terms of they get their reminder, they enter their results, and that goes through to the clinic. And it's one standard flow. So what we've found in terms of sending out reminders reduces the DNA rate. So less people forget. They have a reminder 8 o'clock in the morning. They're not going to forget or less likely to forget to take their e-INR reading. We're increasing patient engagement. The service that I currently use via SMS has no actual engagement with the patients. It's purely a one-way communication. So our technology is a two-way communication platform, which means we can answer questions and we can respond to patients. We're reducing the clinical administration. So the onerous task of re-entering information, mistyping, miscommunications is all been reduced. And that lapse of 4 days, in my case, to receive my letter, this is all done now in real time. So reducing, increasing the productivity in terms of the DNA rates being lower, increasing the patient engagement, reducing the clinic administration, and providing the patient with an overall better level of service in terms of engagement and real-time information. So that's it in terms of my demonstration and what we're doing. Hopefully you've seen that we're able to increase the patient safety and improve the quality. I would like to thank you, Joe, for hosting me today, and to wish you best of luck with National Thrombosis Week. I appreciate the opportunity to speak here and to showcase our technology. to such a wide audience, and would like to open up the floor to any questions that people may have.
Thank you, Paul. That was really interesting. Thank you. And to remind the audience again that please do use the Q&A tool to put in any questions you might have. Some that have come previously, and I'm aware of, is the technology, obviously, as you described at the moment, in many clinics varies and is often labour intensive. Yours relies on IT. Does it suit all? Because each centre or many different centres will use a range of different IT options. Can this work across many different IT software?
Yeah, I suppose that there is a dependency on that third-party provider, because we would be looking to pass information to and from that third-party provider. We don't have to. We can keep it within our technology, and then there is a manual process for the clinic to take that information. I suppose that what we are doing, Joe, is purely the communication piece. So we're not taking away from the monitoring that is already going on. That's not our technology. Our technology is purely the communication. So if we can use our technology and communicate to those third-party monitoring softwares, this could be totally automated. And that's where I would ideally like to get to. If there are challenges around that from various different third-party providers, then ours could be standalone, and the patient could go through the process we saw there, where they enter their details, they acknowledge or answer the health questions, and then record the INR for a clinician to pick up. So I suppose there's two levels. Ideally, we'd want it fully integrated to the third party, as I think that would be the most seamless and most efficient way of doing it.
And obviously, as a third-party provider, how do you ensure confidentiality, and especially around patient records, etc.? What safeguards are there?
Yeah, so we're not actually holding any data on our side. So we're purely that communication channel. We take the information they provide. It's information that is then passed straight through. So we actually have no database on our side, which is why we actually only want to do the communication channel.
Okay. And can anybody adopting this technology opt for the messages which are sent out so they can be tailored to what best suits that clinic?
Yeah, totally. So all the messages we saw today, that's something that I defined based on my experience. The different practices could have different messages, and they may have either different answers, obviously different images, different buttons. That's all user definable.
Okay, thank you. How much training? So if somebody was to adopt this process, which does seem to be much more in tune with the individual patient, but how much training is required for that healthcare provider?
Okay, so typically what we would do in either in the aviation space or in the healthcare space, we would work with the healthcare provider to do the initial design. So in terms of the content of the messages, and any images, buttons, etc. So we would work with them, and we would actually do that configuration ourselves. They would approve and refine as necessary, and then once the service goes live, we'd be working with them in terms of our back-end technology. But typically, it's hours in terms of that hand-holding. There's literally one screen where you see the values coming in, and then so it's pretty minimal, to be honest, Joe, in terms of that training.
Okay. Now, obviously, there's that side, but there will be some patients who this would not suit. Yeah. But would there be any, or is there any training or information documents to share with patients? So, for instance, whether to expect a reply, because if they didn't, they'd know there was an error. So is there anything along the lines to safeguard what they expect as well and how they use it safely?
Yeah, there's nothing that we have in place at the moment. We'd look to work with the clinic in terms of how that is communicated to the patient. So, obviously that the patient will need to know that their process is changing. So that will need to be communicated either via, via a letter or whatever form that takes. But then equally, then we would look to work with the clinic to do a little video with them of how the service works.
Okay, thank you. Now, I know you've used it locally. Have you had any feedback either from healthcare professionals or other patients who may have used this system?
Yeah, we have, and a lot of some of the facts that we pulled out there in terms of the DNA rates are better. We actually see in one of the clinics that we're working with that their DNA rate is actually reduced by 25% compared to SMS. So from a clinical perspective, that reduces the need for the follow-up calls and all the additional admin side. And then the patients are actually enjoying the experience.
Gosh, that's very good, isn't it? Okay, thank you very much, Will. I think we've exhausted the questions, but if anybody wants to discuss any more about this and how to find out more, they can contact you via your exhibition page where there's contact details. Thank you very much.